Hello, my RPM and CCM family. I am here to talk to you about how to look at the population and pick, based on your population, how many people do you think would benefit or be eligible for CCM and or RPM. I'm talking interchangeably because each code for CCM and RPM by clinical staff is 20 minutes. So think about that as, again, really talking strictly time. How many people can you expect to get into the program with your panel of, so let's say if you're working with a primary care provider that has a panel of 2,500 patients, you want to look at, first of all, Medicare patients, because those programs were created by Medicare and some private insurances still do not pay, especially for CCM. So let's concentrate on what we know, people that will be eligible and you'll get paid for it. So out of 2,500, maybe 1,500 have Medicare. Now remember that both programs do have a cost sharing component. So if you wanted to narrow that field down to people that are dually eligible, which means they have Medicare and secondary insurance, again, you have to check because not every secondary will pay 100% of that 20%, which I know is really confusing. But let's narrow down maybe dual eligible patients, everybody that has Medicare and another insurance. Maybe you're down to 1,100 patients. And then you want to look at how many of them have 2 or more chronic diagnoses. Let's say 1,000. And now that you have a list of 1,000 patients, don't assume that 1,000 will say yes to you. The industry standard, from what I'm seeing, is about 40% acceptance rate. Again, if you're a provider or you're doing it within your own office, it's going to be much higher. But I'm talking industry standards where providers are just giving lists to patients of their patients to a third party, and that third party starts calling. So again, let's look at dual eligible patients with 2 diagnoses, about 1,000. So you most likely will get 400 people that will say yes to, either CCM or RPM. Now that you understand approximately how the funnel works, let's think about how many care managers or care coordinators or nurses or whoever you want to call your clinical staff. How many do you have to hire in order to take care of 400 patients? So this is simple math. And if we look at how many working days we have per month, it's 21 times 8 hours per working day comes to 168 hours per month. Remember, CCM and RPM are both monthly billing. Since both programs or either programs are billed in 20 minutes increment, you can potentially bill for 3 patients per hour. So each case manager can have 3 patients in any particular hour. So then when you take 168 hours times 3, that comes to 504 patients. This is assuming that your care manager is putting 100% of their work, and we're not talking about lunch breaks, those are separate, but 100% of their work is going towards billable time. Their caseload is 504. Well, we know that that's not reasonable and not practical. So if you think that your care manager will spend about 80% of their day working with patients, it comes to about 403 patients per month. And if it's 70%, then it's 352 patients per each care manager. So my recommendation is that full-time care manager should be able to handle 350 to 400 patients. And if your question is, well, what are they doing in that other 20 or 30% of the day? And again, take breaks and lunches aside, because that's above 8-hour day. We're talking about things like meetings, team meetings, maybe one-on-one with the manager, entering email from the manager to the case manager. But anything they do with or on behalf of the patient, that time should be counting. So if the care manager is doing a Google search on I don't know, maybe the diet for people that have congestive heart failure and end-stage renal disease and diabetes, then the chart should be open and the time should be counting, because that's work on behalf of the patient. If the case manager is, maybe called Meals on Wheels to try and get people to have them set up and they're on hold, or somebody's calling them back, all that time should be counted. What I found is sometimes people are not aware what can be counted towards CCM or RPM, and I will be more than happy to do another webinar on that. So thank you so much for watching. Good luck to you, and ask me any questions you like. Thanks. Bye.